Data available for clinical trials and evidence obtained from clinical observations continually show that patients suffering from chronic pain almost always exhibit symptoms of increased cognitive impairment, depression, and anxiety. In most instances, the use of psychotropics for corrective therapy is a solution. Peace and light to you all. My name is Dr. Sonia Fulgham, and today we will be discussing the treatment of pain using psychotropics. I will focus on the mechanism of action of the most commonly used psychotropic drugs with respect to pain relief, dosing and dosing strategies, side effects, and availability of FDA approvals where applicable. Duloxetine, gabapentin, carbamazepine, pregabalin, venlafaxine, milnacipran, bupirin. Duloxetine is an antidepressant that is popular for treating diabetic peripheral neuropathic pain, chronic muscular pain, pain related to osteoarthritis, and mechanically low back pains. With respect to pain relief, duloxetine is also thought to calm down pain and pain signals by elevating the levels of norepinephrine and serotonin. This happens through the stopping of the reuptake of these two naturally occurring substances into the brain cells. Duloxetine is between 60 milligrams and 120 milligrams per day, depending on the pain intensity. However, the basic recommendation is to titrate the dosage of 60 milligrams per day and maintain the dosage for no less than 4 weeks, depending on how the patient responds. You can titrate up to 120 milligrams per day with suitable monitoring of vital signs and repeated lab analysis. Duloxetine may cause dizziness, nausea, fatigue, and somnolence. Notably, duloxetine is the only FDA-approved antidepressant for the treatment of pain. Gabapentin is classified as an anti-epileptic drug or anticonvulsant, although it is also used in relieving pain after shingles in adults. Gabapentin's mechanism of action with respect to pain relief is through blocking the toxic phase of nociception induced by carrageenan and formalin. It also exerts a potent inhibitory effect in the models of neuropathic pain of thermal and mechanical adonia and mechanical hyperalgesia. The recommended starting dose for gabapentin is between 100 milligrams and 300 milligrams at bedtime, or 100 milligrams to 300 milligrams twice a day with slow titration. The maximum dosage for gabapentin is 3,600 milligrams per day. Gabapentin may cause sedation, dizziness, peripheral edema, and weight gain. Although gabapentin is not approved by FDA for the treatment of pain, it is approved for post-therapeutic neuralgia and seizures. Structured like tricyclics, carbamazepine is a sophisticated anti-epileptic drug. Carbamazepine works by blocking sodium channels and has analgesic effects by blocking the synaptic transmission within the trigeminal nucleus. Carbamazepine's dosing and dosing strategy is to start with a dose of 100 milligrams twice every day, with a titration of between 400 and 800 milligrams daily. The maximum dosage per day is 1200 milligrams. The side effects of carbamazepine include anticholinergic effects, hypoatremia, blood dysphagia, changes in ECG, and increased LFTs. Carbamazepine is approved for bipolar disorder, seizures, trigeminal neuralgia, and neuropathic pain. Also, an anti-epileptic drug for treating seizures, pregabalin is also prescribed for the treatment of fibromyalgia, postherpetic neuralgia, central neuropathic pain, and diabetic peripheral neuropathy. Pregabalin works by binding to voltage-gated calcium channels and decreasing the release of excitatory neurotransmitters. The recommended started dosage for pregabalin is 50 milligrams 3 times a day or 75 milligrams twice a day. However, dosage may be increased after 3 to 7 days depending on patient's tolerance level and response with the maximum dosage of 600 milligrams per day. The side effects of pregabalin are similar to those of pregabalin, although the sedation effect is less. Pregabalin is approved by the FDA for treating seizures, fibromyalgia, postherpetic neuralgia, central neuropathic pain, and diabetic neuropathy. Vilaxafen is an unusual mixed-action antidepressant trading under the name Effexor. Its mechanism of action entails the inhibition of serotonin reuptake at low dosages and the reuptake of norepinephrine at higher dosages. Normally, the starting dosage is 75 milligrams per day, although this could be increased gradually to the maximum of 375 milligrams per day. The side effects of vilaxafen include drowsiness, nausea, fatigue, and dizziness. The FDA has not approved vilaxafen for treating pain. Milnacipran is a serotonin norepinephrine reuptake inhibitor, which trades under the Savilla brand name. Milnacipran's mechanism of action entails inhibiting the reuptake of both serotonin and norepinephrine through its exhibits mild affinity in the inhibition of N-methyl D-aspartate. The recommended dosage is 100 milligrams daily, taken in dosages of 50 milligrams twice. Depending on a patient's response and tolerance, the dosage may be increased up to 200 milligrams per day, taken at 100 milligrams twice per day. The most common side effects of milnacipran are nausea, vomiting, dry mouth, constipation, dizziness, insomnia, and hypertension crisis. The FDA has approved milnacipran for the treatment of fibromyalgia pain. Bupivacaine is an antidepressant drug that is normally used for treating seasonal affective disorder and major depressive disorder. Its mechanism of action revolves around inhibiting the norepinephrine dopamine reuptake. Bupivacaine's recommended starting dose is 100 milligrams twice daily, with a typical maximum therapeutic dosage of 450 milligrams per day. The side effects of bupivacaine include seizures, blurred or tunnel vision, confusion, and swelling and or pain in the eyes. Despite the FDA approval since 1985 for the treatment of depression in adults, smoke cessation, and seasonal affective disorder, bupivacaine is not FDA approved for the treatment of pain. So there you have it, ladies and gentlemen. As I close out this presentation, kindly take note of the following important points. Pain, and especially chronic pain, is associated with triggering or elevating the levels of cognitive impairment, depression, and anxiety. While other treatment options are also helpful, there is a growing acceptance that the use of psychotropic drugs for the treatment of pain is beneficial. However, the number of psychotropic drugs that has been approved for the treatment of pain by the US FDA is very low, with duloxetine, pregabalin, and meloxicam being the example of FDA-approved psychotropic drugs for the treatment of pain. So there you have it. Thank you for participating in this presentation, and have an amazing day on purpose. Peace and light.